Welcome back to The Explainer. If you've ever found yourself wondering how industry leaders actually quantify the resilience of a medical supply chain, well, you are in exactly the right place. Today, we're taking a fairly dense but absolutely crucial document, the SASB Sustainability Standards for Medical Equipment and Supplies, and we're going to break it down into a truly actionable guide.
But before we get lost in the metrics, we have to step back and ask a fundamental question. What actually happens when a medical supply chain breaks? We aren't talking about your latest online shopping order getting delayed. In the medical equipment field, a supply chain failure isn't just an inconvenience. It is a direct, immediate threat to patient health and, subsequently to corporate viability. The stakes literally could not be higher when human lives depend on the right equipment arriving at the exact right time.
The source material is crystal clear on the severe consequences of failing to ensure quality and traceability throughout that chain. Think about the domino effect here. We're looking at massive regulatory fines, millions in lost revenue, and deep, lasting reputational damage. But most importantly, of course, it poses direct consumer health risks. If a surgical tool or a life-saving monitoring device is compromised just because of poor supply chain oversight, the fallout is devastating for everyone involved.
To prevent those catastrophic failures, companies really have to demonstrate control. And they do this through three specific SASB codes, which we'll call the 3 pillars of trust. Pillar 1 is third-party quality audits. Pillar 2 is tech-driven traceability. And Pillar 3 is critical material risk mitigation.
Okay, let's dive right into Pillar 1, third-party quality audits, evaluating internal and Tier 1 facilities. If you look closely at the standard, specifically metric HC-MS-430a.1, you'll notice something really interesting. The standard isn't asking for some vague promise of quality or a broad, fluffy policy statement. No, it demands hard, quantitative numbers on exactly how many of your facilities and your direct suppliers' facilities are actually participating in independent audits for manufacturing and product quality. Now, you're probably already thinking of ISO 13485, and you'd be right on the money. It's the prime example of a recognized independent standard used for these critical third-party audits. By definition, this is the gold standard for medical device quality management systems. It's exactly what external auditing agencies use to ensure that the design, the monitoring, and the control of facility processes are up to strict regulatory standards. It essentially proves that the products are consistently safe and effective.
So how do we actually crunch the numbers for this? It's basically a 3-step formula. First, you identify your direct, Tier 1 suppliers. These are the facilities you're transacting with directly. Second, to make this actually manageable, you filter that list down to the suppliers that make up at least 90% of your total supplier spending. And finally, you just divide the number of those participating facilities by the total number of facilities in that group. Boom! This gives investors a clear, comparable percentage of your audited supply chain quality.
Moving right along to Pillar 2, tech-driven traceability, tracking the product journey.
First off, we really need to clarify what traceability actually means in this specific context. Traceability is maintaining the ability to capture the exact who, what, and where of a product's life cycle. It is the ability to track identifying information. We're talking the exact production date, the precise location, and the entire processing history. If there's an adverse event or a recall, you absolutely need this data instantaneously so you can isolate the issue before it spreads like wildfire.
And keep in mind, this tracking isn't just happening at the factory door. You have to monitor the whole shebang, the complete timeline of distribution stages. It starts at raw material sourcing, moves through the production floor, hits transportation logistics, continues all the way to the retail or wholesale level, and finally reaches the point of delivery at the healthcare provider's facility. A blind spot at literally any of these stages is a massive potential point of failure.
To maintain that vital product data across all those stages without losing your mind, the standard leans heavily on specific tech-driven efforts. You've got your standard barcode technology for scanning physical labels at transit checkpoints, of course. But then you have RFID, radio frequency identification, which is a total game changer for wireless tag tracking and rapid automated data capture. And to bind all that physical tech to your human processes, rigorous chain of custody audits provide verified, indisputable documentation of every single transfer of goods.
All right, finally, let's tackle Pillar 3, critical material risk mitigation, managing essential and scarce inputs.
The crucial thing to understand here is exactly how the standard defines a critical material. It basically sits right at the intersection of two conditions. On one hand, the material has to be absolutely essential for the product to even function. On the other hand, it must be highly subject to the risk of supply restriction. Basically, if you absolutely needed to build a life-saving device, but you might not be able to get your hands on it due to physical limits or geopolitical drama, yeah, it's a critical material.
We are talking about base elements like cobalt and tungsten, platinum group metals like palladium, and rare earth elements like neodymium. These aren't just obscure squares on a periodic table. They are literally the physical building blocks of modern medicine. From advanced MRI machines to highly precise surgical robots, their global supply chains are incredibly complex and, honestly, highly volatile. So, to mitigate the physical, price, regulatory, and reputational risks tied to using these scarce materials, companies have to get incredibly proactive. The source text outlines 4 main approaches to deploy and report on: diversifying your suppliers so you aren't reliant on a single region, stockpiling materials to weather short-term shocks, aggressively researching alternative or substitute materials, and investing in recycling technology to actually reclaim these elements from end-of-life products. Now, I know what you might be thinking. If I disclose my shortage risks, aren't I just giving away trade secrets to my competitors? Well, actually, there is a very important caveat here. The standard explicitly accounts for this by offering confidentiality protection. You can totally protect your competitive advantage by withholding the specific name of the material, just as long as you still fully disclose the existence of the risk itself, the type of risk it poses, and your overarching management strategy to mitigate it. Which brings us to our final thought for today. I really want to leave you with this question to chew on. Take a hard look at your supply chain. Is it a hidden liability just waiting to trigger a massive product recall? Or is it actually your greatest strategic asset? By moving beyond viewing these SASB metrics as just mere compliance exercises, and instead really using third-party audits, tech-driven traceability like RFID, and critical material mitigation as a roadmap, you can build absolute corporate resilience. Understand these metrics, implement the strategies, and you'll build a foundation of trust that protects both the patient and the company.